everyone. Welcome back to the Concussion Discussion Series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI, and today I am here with Dr. Erik Reis from the Neural Connection, and we're going to be talking all about living your life after concussion. So, Dr. Reis, so excited to have you here.
Yeah, thanks, Amy. I'm excited to be here as well.
Yeah, so I think today's subject is super important. We talk about this new normal after concussion and brain injury, and, what does that mean? And, it took me a good year to figure out what my new normal was. And so many people grieve who they were and have a hard time moving forward with who they are now. Right. And so I'm excited to kind of just jump into this and how we can better move forward with our lives after a concussion, because the truth is they may or may not go back to what it was before. Right. And so we have to learn, how do we embrace this and move forward with, because we may have lost a skill, but we probably have something else that we can offer the world. Let's go ahead and jump in. And where would you like to start?
Yeah. Well, I think it's a good question to ask. I think it's a difficult question to answer. And the reason why I say that is because, first and foremost, everyone is so different, right? Every brain that I see in the clinic is vastly different than everyone else's. And that's a good thing. That's why brains are cool. That's why we all have different personalities and beliefs and followings and things like that. But it's really difficult for a provider to be able to say, this is exactly what's going to happen. This is exactly who you're going to be. This is exactly what we expect. Now, we have expectations and we have things that we hope to plan out and be able to educate you on. But I think it's really important from my standpoint as a clinician to really establish a solid connection with the patient and to, first and foremost, set expectations, right?
Yeah.
I have to understand what you're looking for, who you were before, where you're struggling. And that's why we do a history. That's why we spend time together and do intakes. But more importantly, too, I think one of the biggest parts about medicine that we're missing now is building that connection. We have to have conversations. I want to know who you are. I don't want to know just your symptoms. I want to know what you did before your concussions, what drives you, what motivates you. Are you a family man? Do you love your business? Do you tell me about what you are and what you do with this thing you call life. And that's a really big deal because it's a big motivator for a lot of people to stick to their programs. And more importantly, too, it gives you a gauge of what you may be able to get them back to. And, a concussion or a brain injury 20, 30, 40 years ago was kind of a jail sentence. They just said, hey, this is what you got. Yeah. This is what you're left with, and good luck. We'll let you know if anything else comes by. And a lot of that stuff has vastly changed. We know that the brain changes until the day you die. Neuroplasticity is something that has opened up so many gates for so many providers and patients to get better, to seek new treatment, to gain functionality back. And I think it's a really important factor for everybody involved in this process, not just providers and patients, but caretakers, family members, friends, individuals who are still in your support structure, to understand that. And more importantly, too, be a part of the solution and not the problem. So, the question is relative and it's valid. The outcomes and the answers are very subjective, and they're varied, I guess, is the best way to put it. Now, that doesn't mean people can't get better. They can't get back to the normal status quo. But what do you do when somebody can't get back to the job that they wanted to go back to? How do you navigate those waters? And that's where the relationship really comes in, is building that trust and navigating those uncharted waters with the individuals who are helping that patient make that decision to go back to doing what they wanted to do in the first place.
And, and I think it's challenging when you see, for instance, a neurologist, and they tell you, it's been a year, this is the best you're going to get. There'll be no more improvement after a year. Some people are told 2 years. And we've learned neuroplasticity can happen at any time. I was almost 4 years out when I finally got the right help. So, just debunking that myth. I think doctors mean well, but I don't know. But it's confusing, right? And
Yeah.
we're getting these mixed messages from healthcare providers. But, you know, the whole going back to work and this expectation that, well, you just had a concussion, you should be better in 6 to 8 weeks. Well, all of a sudden it's 24 weeks and you still can't function. Like, how do we help people navigate that? Like, it's so confusing. And like you said, it's variable because someone could be better at 6 weeks where
Yeah.
someone might not be better at 6 years. So how do we help people understand that part of it?
I think we really set ourselves up for failure when we started getting used to standard like cookie cut approaches to conditions, right? You take a pill for this, you do a surgery for this. Oh, you just need a chiropractic adjustment for this. It's never worked that way. We're not binary. We're not computers. We're not on and off. We don't need just, one thing. Sometimes when you do, it's fun. Like that's a really cool party trick. And we've, every provider out there has had those cases where they're like, yep, this person responded to this one thing. That was it. We nailed it. Slam dunk. Great. Good to go. Right. It doesn't always happen. And if it did, my job would be a lot easier. So, I think it kind of comes back to the same question that we were starting with is, we have to be observant. We have to set expectations, right? We have to kind of under promise and over deliver. And what I mean by that is saying, here's where the capacity is for you to get better. Here's where I see some changes occurring. Here's what I think we can do. Let's see how far we can push this. And then you're always reevaluating. The hard part with a concussion is somebody starts off and let's say their, normal functionality is like right here, right? They're an average person working. Maybe they've got pain. Maybe they're fatigued. They're tired. Standard person, I forget what the stats are for like medications, but let's say they're on some medications for some heart issues or types of diabetes, things like that, right? Standard American setup. Also, they get a concussion, they get a brain injury, whatever it's going to be. Now their functionality goes from here down to here, right? So they're almost in a deficit, we would say. They get headaches, they get dizzy, they are disconnected, they're fatigued, they can't speak as well. The real world's just a little bit more chaotic than it used to be. That's tough because now they can't do the things that they just took for granted, right? Yeah. Going from seated to standing, taking a walk with their dog and a loved one, going to the mall and going shopping or getting groceries, driving in a car sometimes becomes very chaotic. So the real world becomes a very interesting situation and environment for them, and they don't know how to handle that. So, we start working on these pathways and this integration with these different systems and doing rehab and looking at nutrition, we start getting them better. But if we can only get them back to 50% of that or 20% of that, or maybe we get them back to 100% of that, how does that change their perspective on things? Can they go back to their jobs? A case in point is I've had patients who do really well with whether it's a week intensive or they do well with, a couple of weeks or a couple of months worth of therapy. They're getting back to doing stuff, and all of a sudden they start pushing themselves a little bit, which I tell patients they need to do, right? We need to stress test where you're at to continue to make sure you're good. And then when you're good, get out of here. Like, I'm cool, but I'm not that cool. Like, I don't want you hanging out with me any more than you need to because you should be out living your life and doing the things you want to do. That was our goal that we established right away when we started having a conversation. What do you want to do? How can we get you there? More importantly, how fast can we get you back to doing the things you want to do to get out of my office? And the problem with that is we don't set expectations. If we don't have those hard conversations with those patients, then we fail in so many different arenas with that. We don't get them better. Our outcomes struggle and suffer as a result of that. Their quality of life goes down. They spent a lot of time and a lot of money without getting the outcomes they were looking for. So setting expectations is big, but really empowering people to move in that direction. Some people don't care about their job. They just want to get back to being able to hang with their kids and have the grandkids and have 5 little humans running around and they don't get dizzy anymore. Okay, that's a goal that we set. I don't care if you want to get back to looking at, if you don't want to look at spreadsheets anymore, cool. We won't worry about that. Let's get you back to being able to handle your grandchildren. Those conversations need to happen. And in the life that after a concussion, like I said, is no longer a jail sentence, right? You can function in normal society with having those things. There are modifications we can give. But I think more importantly too, the beauty of living in 2020 is we know a lot about the brain. We don't know everything. We never will. That'll never stop me and my colleagues from ever trying to know everything. But what we understand is that your brain is virtually limitless, and you have areas of the brain that create new cells throughout the rest of your life. You have areas of the brain that can always make new connections and new branches and new synapses. So, you have a limitless capacity in some way, shape, or form with that. We just have to understand that we always have to keep pushing you and improving. And so it's setting that platform and making sure that the foundation is there. And then more importantly, too, helping to rebuild the house in any way, shape, or form that's available for us. Giving people back their independence is probably one of the biggest things people really genuinely want at the end of the day. And sometimes we forget about that.
Yeah. Yeah. And, it's a challenge when you can't do the things that you used to take for granted. Your whole world's flipped upside down.
Yeah.
And it's challenging. And like I said earlier, for me, it took almost 4 years to find the right help, finding functional neurology. There are providers like you out there who do know how to help us. I got fed up with being told, well, it's a year, you're not going to get any better. It's just anxiety. You're just depressed. It's like I heard the whole gamut of reasons. And I knew, I'm a very driven person, and I was trying my hardest to get better on my own. I was doing yoga. I was going for walks. I was limited in what I could do, but I would try to do something, and to have doctors just keep telling you, no, nothing we can do. You're just depressed. You're not going to get better. You're just depressed. Here's some medicine. And it's how do we get people out of this cycle? I know it's doing summits like this, but we need to how do we crack that code to help people get to the other side of that and get them on their path to wellness?
Yeah. It's a fully loaded question.
I know. Sorry.
No, and I love it. I think we should be asking those questions. That's important, right? That's the way progress is made. I think there are a couple of things. One of the first things I usually tell patients is that they're not broken, and I say that genuinely, but I say it jokingly as well too. Is you're not broken. You're not stuck this way. Just because you haven't had other providers figure you out yet doesn't mean that that's your new status quo. There are patients that I can't figure out that get figured out by other providers, and that's okay. I know that I don't know everything, and that's okay. The problem is when providers get stuck in the egocentric model of thinking that they know everything and that it's their only way. It's their only way, the highway, and that's the end all be all, right? I don't care where you went to school. I don't care how many acronyms you have behind your name. First and foremost, you need to have passion and you need to care about your patients. And then second of all, too, understand that healthcare really should be integrative, and it should integrate different providers, different opinions, different people to come together for the common good of the patient. That's really what healthcare should be and will continue to travel into, because there are different skill sets and different biases and beliefs that we all carry with us. So if you're a hammer, you're looking for a nail, right? So I think it's important for us to realize that there are limitations with those thoughts. More importantly, too, with a lot of patients who aren't getting better, let's just put it this way, if it was a lack of willpower, you would have figured it out. Right? If you're a driven, strong, motivated individual, if you're the corporate executive who has 5,000 employees and you have a concussion or brain injury, it's not that you're not motivated. You've got an entire business running on your back for you to get back. You're motivated. You want to do whatever it takes, and you'll burn the candle at both ends to try and get back to that. The problem is that it's not that easy. It's not just a lack of willpower or motivation. It's understanding the interplay between your structure, your neurology, your nutrition, your mindsets, your environment, and a lot of external factors that we don't always put together with medicine to really understand this whole integrative picture of, structurally, neurologically, metabolically, spiritually. There are a lot of things in that as well. And that's why integrative medicine is so powerful, is because you can take a look at all of those and you can understand them, and you can bring different people into the conversation to see if you can benefit so many different levels than you could if you were just by yourself. So, I think doctors are a bit to blame with a lot of this stuff. Nobody really ever plans on getting married and then planning on having a divorce, right? Nobody ever plans on going into medicine and not getting patients better. Nobody ever really plans on these situations, and that's real, but small decisions add up to big outcomes over time. I think there are a lot of really, really talented providers who are stuck in a model that doesn't facilitate health. If I was a doctor in a hospital and I only had 10 minutes with my patient, whether they had diabetes or they had a concussion or whether they broke their ankle, if I had 10 minutes to form a relationship, take a history, do an examination, formulate a diagnosis, and figure out a treatment plan, I would be in a bad spot because there's no way I can honestly do it. And so it's difficult because we have a model that's dictated by many outside factors and resources. And I'm not saying that that's wrong. What I'm saying is that we have a lot of improvement to make. And the problem with all of this is that people are suffering far more today than they were a long time ago. Now, we have amazing healthcare on the grand scheme of things of, in the United States, if you had a heart attack, if you had a stroke, you are in literally the best state or United States, the best nation possible for you to get acute traumatic care. And that's great and that's awesome. Where we fall off the deep end is anything after the acute stage. For the chronic, for the rehabilitation, for the 2, 3, 4, 5, 10 years down the road where people are still struggling with some of these outcomes, that's where we're failing. And that's where I think a lot of these different types of therapies and neurology and orthopedics and rehabilitation and nutrition can really come into play to say, hey, we're going to supplement all of these different factors together to make sure we can improve quality of life down the road. Because what we're seeing now is we're seeing a generation of the baby boomers, right? And they are, just a vast amount of people who are really struggling. And the problem with that is a lot of their problems that they're having with Alzheimer's, with dementia, with diabetes, things like that, would have been really easy to treat 30, 40 years ago if we would have implemented a lot of these things about looking at your nutrition and movement and exercise and sleep and all of that. And that's the problem. That's why drug companies are having a really hard time finding prescriptions or pills to cure Alzheimer's. It's not a 1 week, 1 month, 1 year process. This is like 20, 30 years in the making. I mean, we're looking at a lot of these diseases as, multiple sclerosis, Parkinson's, and Alzheimer's as neurological diseases that start in the gut, preceded by 10 to 15 years of gut dysfunction, local inflammatory responses in the gut. We have T4 immune cells that literally will crawl up the vagus nerve and go into the brainstem and affect the brain. I mean, this is research that's coming out over the last 5 to 10 years. So what do we do about it? Well, we didn't know 30, 40 years ago how that stuff worked, but now we do. And now we have to implement those practices to make sure we're all up to date. And more importantly, too, asking the questions to get the answers we're looking for. And a lot of patients, bringing this back to the question that you asked about, kind of how do we, start making these changes and implementing this stuff. One of the fundamental problems that I see with my patients coming into the office is most of them don't even have the knowledge to ask the questions to get the answers that they're looking for. That's a flawed system to begin with. I mean, we live in the information age where, your cell phone is a high-powered computer from the 90s, right? I mean, it's super powerful. You can get any information you want, but you don't know if it's right or wrong. And a lot of people don't understand the right questions to ask to even get themselves in a situation where they can find progress. And I think that's a difficult component that we really need to change from a provider standpoint, because doctor is Latin for teacher or to teach. And we're not really doing that much today as we should be.
Yeah. And, earlier you said, it's not just the patient that needs to be involved. It's the caregivers and the spouse and the family and the parents. And I think that's so critical too, because oftentimes the families don't understand. Like, it was a relatively minor incident, right, that caused their concussion. And they can't understand why Susie is still struggling. She looks fine. She can walk. She can talk. I don't understand why she thinks she's still struggling. And, that's a huge psychological component of recovery as well, is having the family not understand. And so having them involved in the whole process too, like the whole family sitting down and watching the series, right? Like that can be so helpful in helping everyone get on that same page of, what's next? Where do we go from here?
Yeah. Well, and I think a fundamental problem specifically with concussions, with brain injuries, if somebody has a stroke, right, and you see some posturing or you see some sort of deformity or change in the body, people don't question. They're like, oh, we had a stroke or something's going on. Or let's say you're in a wheelchair. They're like, oh, okay, well, something obviously happened to that person, and we know that they have some sort of medical condition. But you walking around and still being able to maybe have a conversation or just enough to get by, you being able to move and still grab a cup and make food in the kitchen, but still getting by. People still will assume that you're okay because there's no physical deformity that they can witness, right? Concussions really are the silent epidemic. And that's a problem because then people just assume that you're either lying or you're malingering or you're trying to get attention or that you're just making this thing up. And out of all the patients that I've seen, it's difficult for you to make up some of the stuff that they feel and for the presentation that they come in with. And more importantly, too, just the struggles that they tell me about. And I have a lot of empathy, and I think that's one of the reasons why I love what I do is I get to help people who are in a unique position and have been written off by a lot of major medical institutions for just saying they're stuck that way. I'm a firm believer that we need to continue to challenge that status quo. And so it's difficult because if you base everything off of just your mere observation or your unique perspective of them physically, you're not going to understand even where to go from a neural standpoint, from a cognitive standpoint, just an even emotional standpoint too. And that's difficult, and it's a flaw that a lot of providers, and even me being aware of it, including myself, we all need to get better at, and we need to improve.
Yeah. Well, Dr. Reis, this has been such a great conversation and much needed information. And I am so happy to have had you on the Concussion Discussion Series this year. If people want to get in touch with you and learn a little bit more about what you do, they can find you. Your Facebook page is Dr. Erik Reis, and your Instagram is also Dr. Erik Reis. And if people want to get in touch with you, you're happy to do a phone consultation, correct?
Absolutely. Yep. Hit me up. Let me know what's going on. I tell patients or just anybody in general, I'll be the first person to let you know if I think I can help you. And if not, I'll be the first person to let you know if I think I can. And if I can't, I'll always try and find somebody who can. And I think the best part about being in the community that I am with the colleagues that I have is there are some amazing people around the United States, around the world who are phenomenal at what they do. There are so many amazing chiropractors and physical therapists and medical doctors and, acupuncturists, amazing providers who think very differently and they work integratively to get patients better. So for those who feel like they're stuck, time to have a conversation and see where we can get you. And I think that within itself, if that's all you take away from today's conversation, is worth its weight in gold.
Yeah. Awesome. Well, thank you so much for being here today, Dr. Reis. And thank you everyone for watching. Be sure to like this video, leave a comment below. Let us know something that you took away from today's conversation. And also don't forget to subscribe, hit the subscribe button so you don't miss any of these videos. Thank you for watching, and I'll see you in the next episode.